I also, on a somber note, want to recognize that today marks the 1-year anniversary of Rhode Island's first confirmed case of COVID-19. 1 year ago today, we had our first confirmed case. And I would like to take a moment to thank Rhode Island for being so relentless and heeding our calls to action over the past year. It has been a year of sacrifice, been a year of disappointment, heartache. We've lost thousands of Rhode Islanders. And today I'm joined by two physicians on the front lines. A big thank you to all of our first responders and caregivers and healthcare workers. It's probably been a year like no other that you have had. A year of no break and a lot of ups and downs. So I just want to take a moment to thank you all for your sacrifice and your service as we have gotten through the last year together. We are in now, after 1 year being in this together, we are in a stable place as it relates to COVID-19. We have closed our field hospital, thank God, as of last week. We have a % positivity that is lower than it has been in many months. We are on our way to vaccinating Rhode Islanders, and our hospitalizations have dropped by 65% over the past month or so. So we were, in fact, I was just talking to Dr. Foreman, and she was saying as long as everyone wears their masks, washes their hands, keeps their distance, we ought to be fine. But finally, you can see the light at the end of this tunnel, and I want to reassure Rhode Islanders that today, as of March 1st, we are in a stable position. This afternoon, I am joined by Dr. Laura Foreman, the Chief of Emergency Medicine at Kent Hospital. Thank you for joining us. And also, she also served as the Medical Director of the Cranston Field Hospital. I remember visiting that field hospital when it was being built, and it's amazing to me how quickly it was built and what a fantastic job you did in the time that you had to run it.
Thank you.
I'm also here with Dr. Salim Sooner. Dr. Sooner works in the emergency room at Rhode Island Hospital, where he serves as the Director of Disaster Medicine and Emergency Preparedness. And he was the Medical Director of the Field Hospital at the Convention Center. Same thing, Dr. Sooner. Thank you for joining me. Thank you for joining me some weeks ago on the stage at the Veterans Auditorium. And thank you for your top-notch work at the Convention Center. We had many folks go through the Convention Center Field Hospital and say, essentially, it was so much better than they anticipated. You know, when you hear field hospital, you get nervous, and what you operated at the Convention Center was a first-class healthcare institution. So thank you.
Thank you for your leadership in all of this.
So as we do with these Facebook Live events, I'll be asking you a series of questions. We're here to listen to you, not to me, and I'm here to learn from you. So I'll begin with Dr. Foreman. This year, and you have talked about this in the past, but this year has been exhausting and heartbreaking for frontline healthcare workers. As today we celebrate the 1-year anniversary of COVID, maybe just give us your reflections on what you and your colleagues have lived through and how it is today relative in the hospital relative to, say, in the thick of the pandemic.
So, you know, as you were speaking, I was thinking about a year ago when we were looking at this first case here and thinking about how we actually started preparing for the pandemic when we heard about the first cases in other countries. So by a year ago today, we've spent countless hours already preparing for this by the time we got the first case in Rhode Island. And yet I also remember just feeling so surprised at the beginning at how hard we were hit by this and so worried about our lack of equipment. You know, you remember a year ago we were struggling to get enough PPE. We were worried about having enough ventilators. We were thinking about how do we care for people and how do we decide who gets care if we don't have enough support. But simultaneously in those early days, I also remember being so incredibly grateful that you, Governor Raimondo, shut down the state so quickly, and I think literally saved the lives of countless Rhode Islanders by doing that. I remember being so grateful that for the Department of Health, just working around the clock. I remember Dr. Alexander Scott gave us her personal cell phone number and picked phone calls from the ER at 2 in the morning when we called needing help. And the amount of work done by this state has been staggering. And really, really inspiring. I've just been so honored to be part of this group on the frontline team, but also particularly in the beginning of this, so overwhelmed by the task that was in front of us. You know, I think in the early days of the pandemic, the predominant emotion I remember feeling was fear. I remember being really afraid that it wasn't up to the job of running an ER in the pandemic, afraid that we weren't going to be able to keep patients safe, keep staff safe. You know, I've worked all over the world in war zones and refugee camps, and this was unlike anything I've done before this past year. You know, in the beginning, it was really scary, worried that I was going to get my own kids sick or worse than that. A lot of us throughout the beginning months of this year did not feel safe going home after we worked with patients with COVID. But the outpouring of support that we saw from our community, from the Department of Health, and from other healthcare workers has been really astounding and really humbling. You know, people early on began dropping off handwritten notes in the ER of thanks. They began dropping off pizza and cookies. Thank you guys, whoever did that. Thank you. That was amazing. You know, there have been drive-by parades in the ER. We've learned very quickly to recognize, you know, even through a mask, when someone needs to take a break, when they need to cry, when they need to go outside and breathe some fresh air, when they need to get a virtual hug. This pandemic has definitely taken a toll on healthcare workers. It's been relentless and exhausting, you know, but it's also been incredibly inspiring to see what healthcare workers have been able to do and to see what the community's been able to do in rallying around us. So I think for me, the experience going through this, you know, I think from the early days on, and throughout, we've experienced the same thing as everybody else in the state in a lot of ways: the fear, the isolation, the exhaustion, the frustration of this pandemic. But I think now, a year in, we're also experiencing the first glimmers of hope as well.
Hope is what we all need. So, Dr. Sooner, I just said we closed our field hospitals, which is great. And I said I think we're in a stable place. But what would you like to say to the people of Rhode Island in terms of where we are now as a state with respect to COVID-19? And what should people be thinking about as we continue in the months ahead?
So looking back, there was a lot of unknowns. We didn't know this disease. We were sort of the blind leading the blind in terms of this disease. We quickly understood aspects of this disease and how to treat it. And now we're at a point where we feel comfortable treating COVID-19, treating patients with COVID-19. We didn't know how to do testing. In the early days, I look back and, you know, we set up these stations in front of the emergency department where people can drive by, and we didn't know what kind of personal protective equipment we should be wearing. And those days are over. We have a lot of data that's come in. We've analyzed the data. Dr. Fauci has been great. And thankfully, the leadership in this state is wonderful. Under your leadership and Dr. Alexander Scott, we've instituted testing, vaccination programs, and you had the foresight to build the field hospitals. And we needed them. We used them. And now, you know, we're looking back on those days. The future looks good. It's hopeful. We're getting vaccines in the arms. There are new vaccines being approved daily. What are we up to? 3, 4 vaccines worldwide that we can use now. But we're in a race. We're in a race against new variants. And those scare me because they can reinfect people. The infectivity is higher. So we have to be vigilant. There is light at the end of the tunnel, but we have to continue wearing a mask. We have to socially distance and be very careful when we're gathering with others. Keep our distance, wear our masks. Warm days are coming. We can eat outside, hopefully. But we must be vigilant. I, for one, don't want to see another surge.
So that's a question really for both of you. It's great that we closed the field hospitals. What do you want the average Rhode Islander to hear around what they need to do at this point in their lives to make sure that we don't have another surge and have to reopen the hospitals?
So I think that people need to keep doing the things that we've been doing for the past year, and I hate to sound like a broken record, but masks work, staying socially distanced works, limiting your exposure works, being careful. You know, the simple public health principles that we've been talking about for the past year, that's how we keep trending in this same direction. You know, and I'm hopeful that we're in a really good place now, but I think it's really important to bear in mind that this is a snapshot in time. We're able to close the field hospitals down now in these weeks, but when you look at the graphs of case counts over the past year, it's obvious that we could need them again in just a matter of weeks if we don't continue being careful. I mean, I think I would echo Dr. Sooner in saying this pandemic changes rapidly. The virus mutates, it evades detection. If you think about it, this is a microscopic particle, but the entire human race has been unsuccessful in subduing it over the past year. We can't afford to underestimate it. So I think, you know, I'm very hopeful, but we're not out of the woods yet.
So along those lines, Dr. Sooner, a lot of people are saying, hey, the vaccine is here. I've been vaccinated. Mom and dad have been vaccinated because they're, you know, older. This is it. We're free. Let's go back to normal. What do you think about that?
I wish that was the case, but it's not. We don't know how this vaccine works against some of the new variants that are popping up. There may be some variants that evolve over the next weeks or months that evade the vaccine, that the vaccine is not as effective. And if we let our guard down, we will get infected. And if that vaccine goes from person to person at a faster rate, then we're looking at another surge. And I think we're all tired of surges. I think we need to get back to some level of normalcy. And that may not be the same as it was a year and a half ago, but something close.
Yeah, I think that's well said. Like redefining what is normal. It's not a stay-at-home order. It's not where we were a year ago. But it's a different normal. I was talking to someone the other day and they said, are you going to continue to wear your mask forever? And I think people have gotten used to it, and there are definitely some benefits. What more can we be doing to support frontline healthcare workers? And how, you know, Dr. Foreman explained how fatigued people were in the thick of it, but this is dragging on. It's been a year. Give us a little more insight into how people are thinking and feeling now, and what we can do either in our personal lives or the state or whatever to further support healthcare workers.
Well, I think the support that the community has shown healthcare workers has just been nothing short of extraordinary. Like Dr. Foreman said, during the thick of things, there was so much food in the emergency department brought in by staff, by bystanders, just everybody pitched in. People were making masks at home and delivering them to the emergency departments. It was just a great coming together of the community. And we are really thankful for that, because the healthcare community was stressed, is still stressed. And to see that outpouring was really nice.
Yeah, I think, you know, the two things that I think about people doing now that would be most supportive to frontline workers, the first and foremost is do everything that you can to bring this pandemic to an end as soon as we can possibly do that, which means keep yourself from getting COVID, keep yourself from spreading COVID, keep yourself from needing to take up an ICU bed and a ventilator, you know, wear a mask, stay home, stay socially distanced, come to the hospital when you need us, don't delay seeking medical care, but don't get COVID. And I think that's the number one thing you can do to support frontline workers right now. And then the other thing that I think everybody can do to support frontline workers, which might sound like a really small and simple thing, but just recognize the frontline workers all around you. You know, when you go to the grocery store, when you get a cup of coffee, when you hire a plumber to come into your house, when you ride a city bus, you've got a frontline worker right there in front of you. So remember that and thank them. We can be appreciative, we can be nice to each other. And as a frontline worker myself, I can tell you this makes a tremendous difference. Just say thank you and be aware of the risks that people are taking to serve their community and to put food on the table.
I so appreciate you saying that. You're right. And there are many, such as yourselves and your team, or the bus drivers, the grocery store clerks, et cetera, who haven't had a day off, have been working through and through before we had vaccines, before we, as Dr. Sooner said, we really knew what we were doing. And as we mark the 1-year anniversary of our first case, I would like to thank all frontline workers of all kinds who have hung in there this past year, and through a lot of fear, you know, but they still, you know, they got up and went to work through the fear. So any last messages? I'll give each of you the last word. We'll start with Dr. Sooner at this point.
You know, you can't say this too many times. Wear a mask, socially distance, avoid large gatherings. The sun is going to come out. We're going to go outside, take long walks on the beach. This is the ocean state. You know, perhaps a drink outside, socially distanced with loved ones. And the end is near, but it will be difficult to get there. These last few months, this last push, it's a marathon and we're near the end. So keep it up.
Thank you. Anything else, Laura?
So I would just say, you know, in the US, we've lost over 500,000 people to this virus this past year. So I say that I'm hopeful, but my hope is also very guarded right now. We've got these new variants. We don't know if the vaccines are all going to be effective against them, but if people follow these public health practices that we have in place and get vaccinated as soon as they can, and we're lucky, I do see the potential for this to end sometime. You know, what has given me hope as of late is that people have been able to do really extraordinary things this past year. They've been able to change their behavior to keep themselves and one another safe. We've learned to wear masks, we've learned to work from home, we've learned to socialize over Zoom, we've learned to do without, and we've been willing to sacrifice so much in this state in the name of keeping each other safe. So I'm hopeful because we are doing those things. You know, I think at the end of the day, it's human caring and willingness to adapt to the necessary changes that are going to end this pandemic, and we have so much ability in that.
Yes, that is extremely well said.
And one more thing, if I may, maybe this wasn't said enough. Trust the vaccine. They were developed very quickly, that's true, but the science behind them is sound and they are safe. Trust the vaccine.
Absolutely.
Thank you for saying that. We're starting to see more and more people come out and develop that trust. But I'm so pleased that you said that. Both of you are experts. So I am very hopeful. I understand we're not out of the woods. I join you in imploring the people of Rhode Island to continue to wear masks, wash hands, stay home if you're sick, get vaccinated. But I know that today, you know, instead, sometimes when I have my briefings, we would begin with how many patients are we treating in the field hospital, how many patients are on a ventilator. Now we are talking in our briefings of how many people are being vaccinated per hour. And to me, that is a clear sign of the beginning of the end and a reason to be hopeful, because we have these vaccines. Big news with the J&J vaccine. We have 2 state-run high-volume vaccination centers that are humming along. We're going to have several more up and running by the end of March. So if we stay on the path we're on, vaccinating people at the rate we are, we're going to be in an even much better place a month from now. So while I share your concern about the new variants, and love that you're telling that to Rhode Islanders. I want to end on a hopeful note because, as you said, the vaccines work and we're getting them out the door. So thank you both.
Thank you so much.
Thank you for having us.
Thank you. You guys have been unbelievable partners to me and my administration. I want the people of Rhode Island to know how lucky we are to have such high quality health care in our state. And what you have accomplished in this past year is tremendous. And I want, when you go back to your ERs, please say thank you from me to each and every one of your colleagues, because I know they've had a rough year and I'm deeply grateful, and they got us through. We were hopeful today because of their hard work, professionalism, and sacrifice. So we'll stay at it, but thank you all so much.
Thank you so much for your leadership.
Have a good day.